Jessica, an 18-year-old woman, complains of recent onset flank pain. She is given an analgesic and sent home. A day later, she develops a fever accompanied by nausea, emesis, and worsening flank pain. Upon questioning, she recalls episodes of urgency as well as decreased urine output. On physical examination, we've got a temperature of 39 degrees Celsius and costovertebral angle tenderness. Laboratory values are significant fall: white blood count of 13,900, neutrophils of 74%, hematocrit of 33%, urinalysis 2+ protein, small leukocyte sterase, many WBCs, few bacteria, and WBC casts. What is the most likely diagnosis? The presence of flank pain, high fever, emesis, and costovertebral angle tenderness indicates acute pyelonephritis. Pyelonephritis is an urinary tract infection that has progressed from the lower urinary tract to the upper urinary tract. It is most common in younger children and sexually active women, and it's because men have longer lac-exposed urethra, as well as the antibacterial properties of prostatic fluid. Other predisposing factors include obstruction, catheterization, diabetes, and pregnancy. What are the most likely pathogens that cause urinary tract infections? Escherichia coli is the most common cause of urinary tract infections. Staphylococcus saprophyticus is the second most common cause of urinary tract infections in young, sexually active women. Other common causative organisms include Klebsiella, Proteus mirabilis, and Enterobacter. How can these patients' symptoms be distinguished from those associated with cystitis, urethritis, and vaginitis? The classic primary complaint in cystitis is dysuria, accompanied by frequency, urgency, suprapubic pain, and hematuria. Pyelonephritis may include similar symptoms but is differentiated by the presence of additional flank pain, costovertebral angle tenderness, and fever. Urethritis and vaginitis present with dysuria, discharge, pruritus, dyspareunia, and an absence of frequency or urgency. What are the characteristic laboratory findings in this condition? Pyuria is an essential finding in urinary tract infections. Hematuria is also common in women with urinary tract infection, but not with urethritis or vaginitis. In a patient with urinary tract infection, white blood cells cast indicate the infection is of the upper urinary tract, pyelonephritis rather than cystitis. Additionally, serum test shows leukocytosis, an elevated erythrocyte sedimentation rate, and an elevated C-reactive protein level. What are the treatments for this condition? The goal of the empiric therapy is to use drugs that achieve high concentration in the renal medulla. Oral medications include fluoroquinolones, especially ciprofloxacin, and trimethoprim sulfamethoxazole. Intravenous options include ceftriaxone, ciprofloxacin, ampicillin and gentamicin, and piperacillin tazobactam. This is it. This is our destiny. Again, thank you so much. If you like it, please subscribe. See you next time. Bye.